Now, Missourians still don't know exactly how health care reform will affect state services like home care. KOMU8's Jessie Falwell shows us one mid-Missouri family anxious to know how they'll keep their daughter alive if their coverage runs out.
How about presents?
It's a birthday any girl would love.
Come and sing to her. Look at her.
But it's a sweet 16 Lindsay Carrier's family never thought would come.
Lindsay's on a ventilator.
Lindsay needs 24-hour medical care.
She's deaf. She's in a wheelchair. She gets frequent breathing treatments throughout the day. She has a G-tube that she's fed through.
No matter what time of day,
when she goes to bed at night,
her care never stops.
We go in and we sit up and watch her sleep. Because if her vent falls off or if she plugs that trach, she's gone. It's her life. Hi.
But watch Lindsay crawl, a healthy, growing child nearly 10 months old.
Hi.
But 5 months later, Lindsay received her childhood immunization shot.
When she had her reaction to her DPT shot, it messed with her central, her nervous system, and it messed with the nerves going to her from her ear to her brain,
leaving her with a neuromuscular disorder and without any independence.
I mean, it's just not easy. The care is constant. It never stops.
It's really loud.
It was a rare reaction that no family needs to experience. Not once.
Oh, yeah, these are cute. This is Chelsea.
And definitely not twice.
Chelsea, don't mess with the speaker, sweetie.
More alike than just through appearance, Lindsay's twin sister Chelsea suffered from a similar neuromuscular disorder.
She was a happy, very smiley, go-getter kid. Are you guys show off? She passed away when she was 10. And instead of being the rash that everybody else would get, for some reason it went to her heart, and it didn't take very long for it to take her life. It's going to be 6 years in August, so it's a little bit better, I guess, It's hard.
In order for the Carriers to keep their only daughter alive, the medical bills will keep adding up.
Over there is her bedside ventilator and her suction machine. We have a mini ICU, basically.
Are you going to take that to Lindsay?
Yeah. Still a 16-year-old girl.
Looks like a mall trip, Lindsay.
But if only she could stay 16 forever. The Children's Medicaid program helped pay for Lindsay's nursing care, about 160 hours per week. Services like this only last until a child turns 21. In 5 years, Lindsay will lose that coverage, and nursing care may be reduced by half.
That's the thing that I'm really frustrated with, because I don't completely know what's going to happen. We've talked a little bit with the different agencies that are involved with our care, but they're going to wait till she's closer to 18. They call it transitioning.
Our goal is to keep children with their families.
But agency officials like Robin Kaufman with the Boone County Family Resources say families like the Carriers shouldn't have to worry.
We've found typically that with our partner with the Department of Mental Health, our individuals that we've served that have been in the Lopez waiver have been able to transition into another Medicaid waiver program without having to wait.
You ready?
For the Carriers, it's not about the wait. It's about the coverage, and a new waiver may not be as good as what they have.
I've been told a couple of different things about that, and I don't know what's real, what's not.
Take these to Lindsay.
The question remains unanswered, but one thing is for sure.
For Lindsay, it's never going to change. She's not going to get better. The care is going to have to be there 24/7 always.
Jessie Falwell.
It's her life.
KOMU8 News, Hallsville.
To learn about different adult Medicaid waivers from the Department of Mental Health and the Department of Social Services, as well as to see a list of the different services Boone County's Family Resource Center offers, you can log on to our website at komu.com.